This video is to be used as a review and not to replace the in-person respiratory training. Fisher-Paykel Airvo 2. We have 6 Airvo 2s at Avera Marshall. They are located, 1 or 2 will be in room 212, 1 will be stored down in the emergency room, the rest will be up on 4th floor in the respiratory care department. If you do put one in use, always make sure you have a backup, go up to 4th floor and grab an extra one. If this is set up in the emergency room, you will take it up with the patient to the room on 2nd floor, and then you will grab a new one out of 212 and bring that back down for you. So you always have one. So if you are grabbing this out of, let's say, 212, you will grab the Airvo 2. Everything should be in the basket. You should have water, you should have a circuit, and you should have a connecting tubing. You will be bringing it past the CCU supply room, where you will need to take the disinfectant tube off carefully and put your foot on the bottom. Carefully, 2 hands, take this off. Do not lose this plug. This is a very expensive item. You will put this in the white bag hanging in the supply room, or if you're in ER, put it on the counter. Do not take it in the patient room with you. You will also then grab, at that time, your nasal cannula. We have large, medium, and small adult. We have extra large, large, and medium pediatrics. So when you measure what size nasal cannula you use, never occlude more than 50% of the nares. If you have too small of one on a patient, you will notice that you won't achieve the pressures you desire. If it's too large, it will block the airways and they will have nowhere to exhale. So always try to guess correctly. So now you push it into the patient room. First thing you do, you plug it into your oxygen. Plug it into the wall for electricity. Then you will open up your circuit bag. For education purposes, I already have one open. You will find in that bag a circuit, your water chamber, and this piece here. First thing you do is you grab this, you take the blue top, pull it off, discard it. You take the white piece and you unwrap the coil. Take this. When you hold this with the crack behind you, right here, and hold the water line right like this. You take the top piece here, it fits on here, and that should face away from you. So you got this facing front, this facing back. Once you push that on, you take this and click it up in there. This will keep the water line away from the heated chamber so it does not melt. Now, when you install it, push this down. This slides right in these creases, and you should hear it click. Click. Take this and put it in your water. Stab it straight in and hang it on the back. Now, when you look at the water chamber, all it has to have is some water in there. If you shake it, you can see water running in there. It does not need to go up to the line. If it reaches up to the line, you probably have a faulty float in your water chamber, and it'll need to be replaced. The next thing you grab is your connecting tubing, which I have one open right here. This is how you get oxygen into your machine. So now, of our Airvos, we have one Airvo that has both a pediatric and an adult flow meter on here that bleed the oxygen in. If you have a pediatric patient, you would probably want to grab this one. It'll make your oxygen not bounce around so much. It'll keep it in line better because pediatric patients breathe different. If you don't have a pediatric one available, you can use the adult one. Just know your oxygen is going to float more. So right now we're going to say we have an adult. You do not need to put a Christmas tree in here. This fits on tighter without. This hooks onto here. You take your circuit, hooks only one way, right on top. When it is not on a patient, make sure it is hanging up in this hook up here. Now, when it comes to the buttons on here, there is an on-off, there is an alarm silence, there are your 2 toggle buttons, and here's your mode button. You turn the machine on by holding it down. It'll run through a series of spins. First thing you should see is a stop and go light. Green means go, orange means it was not disinfected properly and you should grab a new machine. There's your green light. The other thing you may see is filter is due to be changed. If you see that, it also says now or later. Pick later, send me a message with the number right here on the side of the machine saying what machine it was. I will follow up on it. It's fine to use it several times after you get this code. So it'll spin until it's ready. Meanwhile, you can start setting up your settings. Just don't put it on the patient. You push your mode button and that toggles through. So you'll see your temperature, you'll see your liters per minute, and that's your flow, and you'll see your oxygen percent. Now, optimal temperature for an adult is 37 degrees. I always start my patients low and work it up before I leave the room, just so that they can get used to it. I also explained to the patient that this is a high flow heated humidity, so the air will be blowing at them a little bit faster than they're used to, and it's a little bit warm, but that is good. It helps heal the lungs, which is a true fact. So push your mode button. There it says 37 degrees. See, it's locked. You change that, you hold down your toggle buttons until it unlocks, and you toggle it down. Adults, it'll give you a choice of 31, 34, and 37. So now to lock that and go to your next setting, you push mode button. It locked it. You go to your next one. Then you have your liters per minute. So an optimal liters per minute on an adult is 60 liters per minute. The higher your flow, the less oxygen you should have to use, is the theory, because they're catching their breath faster. But if you come at them with 60 liters per minute, it scares the patient a lot of times. So I usually start at about 40, work my way up to 60 by the time I leave the room. If they do not tolerate this, I try to make a note in the chart saying, started the patient at 50, let's say, and we'll try to work our way up to 60 as patient tolerates. So let's go over to there. So this is the flow, unlock it. And it tells you your range, 10 to 60. So I'm gonna go up to, let's say 40. Lock it, and then go to your next thing. Now your oxygen, you do not turn up and down on the machine here. That's when you go up to the flow meter here. Now the reason it's covered is because people were getting confused with liters per minute here as well as down there. So this is oxygen, on, off, up, and down. That's it. So you turn the oxygen on, but you watch the percent on the machine. So now when you're thinking about flow, flow is the patient's work of breathing. Oxygen is their saturation. So just keep that in mind as you go. So that's what it looks like at this point. So now, as I said, I would work my temperature up to 34, or 37, excuse me. I would work my flow up to 60. And oxygen, remember, is a drug. You always use the lowest amount possible to get your achieved goal. So you would work on that to keep your SATs as such. Remember, a COPDer, you really only need to keep your SATs 80 to 92. A normal adult, you don't need 100%. You want to keep it, mid-90s for somebody without COPD. So as this warms up, it's going to keep spinning. Once it's warmed up, you will get a check mark. So now on the machine, I have hung a cheat sheet. Oh, there's your check mark right there. That means it's ready to put on the patient. There is a step-by-step instructions, exactly what we did, where things are located, and so on here. So now it's ready for the patient. I would take it off here. I would have the size cannula that I wanted to use. You hook it right in here like this, and you'd put it on the patient. Now, when you put it on the patient, this cannula is super great because it's super soft. These will hug the cheeks so it doesn't slide around. The only negative thing is because this is so super soft, it can move in the patient's nose over if they're moving around, and it'll cause an alarm to go off. Always check your patient first when an alarm goes off and follow it back. The other thing is if they have bloody nose or well, boogers. Just take a wash rag, wipe it off good, and then reuse it if possible. So this will sit on the crown of the head, and this you don't want tight up against the septum. You want it just sitting right below it. And this will help hold it on the cheeks nice. So you'd put that on the patient, and you'd watch their SATs and their work of breathing and adjust accordingly. Let's see. So as far as water bag goes, people are always asking me, how long do these water bags last? For this size bag, approximately 12-hour shift. Now, for the big bag that's double that size, obviously approximately 24 hours. Now, when it comes to the basket on this machine, this is just for Airvo supplies. I don't want to see toilet paper in there or patient's belongings. This is to be where you keep an extra bag of water. It's if a nurse comes in and just does not like the size of the cannula that you have on the patient and they change it, this is where you would put the other cannula. So we always know where the extra ones are, because when you come back on your shift that night, you're going to say, hey, I want that other size back instead of taking new. These circuits are very, very expensive. They're approximately $100 with the circuit cannula all put together. We do not get reimbursed for Airvos at all, so please try to be a little bit careful with supplies. If you need to change it, you need to change it. As far as when they're started, it does say on here how long before they need to be changed. The adult circuit is 14 days, and also the adult cannula. If you have it on a pediatric, the cannula needs to be changed every 7 days. When Airvo was started, I put it on my calendar upstairs and I come down and change it. The only time you should have to change a circuit is if you would have a leak in your line. So remember too, like when it's on a pediatric child, cold, dry air equals bronchospasm. So that's why an Airvo is a good choice for these RSV kids and bronchiolitis and etc. So I'll go through the pediatric mode here in a second. Also remember Airvo, because it's heated humidity, it helps with thick secretions. It helps break it down. Patients can be put all the way down to room air and just keep that flow here too. So remember, it doesn't actually have to be on oxygen at the time. So if you have, it's time to wean the patient, okay? So when you had this patient up at 60 liters per minute, and you always wean your FiO2 first, because remember, it's your drug. The most success we've had here in weaning our patients at Avera Marshall is we wean our FiO2 down to approximately 30%. Then we start slowly dropping our flow, like every couple hours by maybe 5 liters per minute. Get that down to 30. So you get down to approximately 30. At that point, you're probably safe to try a cannula at maybe about 4 or 5 liters, depending on the patient. That's where we found the most success. Now, if a patient is on oxygen at home, a cannula at 4 liters, let's say, well, that's like 36%. Well, you would not then drop this down to 30. You would try to maybe drop it maybe to 40 before you decrease the flow, because the patient's used to that much oxygen anyway. So you have to use a little common sense there. But that's how we find the most success with weaning. Now, when it comes to charting, remember, you have to chart that it's a high flow heated humidity device. Also, make sure you chart your liters per minute of flow. Also, chart your FiO2 so that we can keep a track of where the patient was at what time. So, if you are going to use it on a pediatric, what you do is you come back to your mode button, you hold it down, and it changes it to junior mode. So now your settings will all be different. It'll lock them into a tighter numbers. So now as far as your temperature, now your only choice is 34 degrees, and it'll tell you that. You go over to your flow, you unlock it, it'll tell you that now your flow is 2 to 25. Then you go, now it's saying my oxygen is too high because the flow now is much lower, so the oxygen is going to go up. So this alarm is going to continue to go off, and you can hit silence, but it's going to continue to go off until you fix the problem. Same thing will happen if you have like a blocked nasal prong on the cannula. It'll show it until you fix it. So you have to work on fixing the problem in order for it to go away. See, there it went away. The other thing is, so you want to know when you put on an adult, it's pretty straightforward. But with the pediatrics, you want guidance from the doctor or the respiratory if I'm here. So when you look at a pediatric, what you try to do is you set the flow at approximately 2 liters per minute per kilogram of weight. You start out always a little on the lower side if you're worried about it and work your way up. Another thing with peds is if the ped starts to grunt, okay, or they're grunting, that means you need to go up a little bit on your flow because that'll help compensate for that. But if you have the opposite effect, the patient is having a hard time exhaling, that means that your peds patient, the flow is too high. You need to come down a little bit. And again, always remember the lowest FiO2 to achieve your SAT. Also, when you're weaning a patient, adult or pediatric, and you've turned them down and you've weaned the oxygen down and then you got your flow down, and then it comes to, let's say, night shift. It's always on night shift that the patient seems to have a more difficult. And you're, instead of turning the FiO2 up, bring your flow back up a little bit. And then look at what your FiO2 needs to be. In the morning, guess what? We can start again, or if it's the night, whatever, day, night, whatever. And then we can start again a little bit. Instead of jacking the FiO2 up, go a little bit with the flow, and it'll help compensate it. So now it's beeping because it says check for leaks. The reason is I have it on, I still have an adult cannula on here, and it's picking up on too much flow coming through. So it's very much of a safety feature on here. So now I also get asked, now our cannulas, what size do they fit down to for pediatrics? On your cheat sheet on the back, it tells you that medium goes down to a 0.15 kilograms. So it does go down quite a ways. We hope we never have to use one down quite that far. So as soon as this clears, I'm going to turn it back to the adult mode. So if you do use it on a pediatric, try to be courteous and change it back to the adult mode when you're done, because the next person who puts it on an adult, they get a little frustrated when they're see the butterfly and the birdie on there. So hold this down. There, they fly away and you are back in the adult mode. So when it's time to stop the machine, what you do is you just hold your button down. It'll turn it off. I like to put gloves on when I'm done, and I like to take the circuit off. This is disposable, throw it away. You take your water bag out. If there's water in it, I try to be respectful of housekeeping and I unplug it and pour it down, and tip it in the sink. This you push down and you slide this out. Now be careful because this is hot, and so is that, because it is a heated system. So don't burn yourself. Then you take off your connecting tubing and throw that away. Unplug your oxygen, always. And make sure you have turned off the flow meter when you're done. Unplug it. Now, to clean it, you take gray top wipe. You put it over your gloved finger. You reach in here, you wipe it out. You also poke it in here. Now, you never poke anything in this side because you see there's something in there. You do not poke anything in there. So you wipe the rest of it all down, including the papers, and then you grab your disinfectant tube, move it away from an oxygen source, because this disinfectant tube, when it's running, is over 200 degrees, and the company said you have to be careful not to have a fire, so keep it away from an oxygen source. So I always recommend that if you push back maybe by the CCU nurse desk or another desk down in ER, but don't put it in their supply room until after the disinfectant phase has been done and the basket is restocked. Put this in here. This goes in the hole that you do not poke into. This one goes into that empty spot. You plug it into your electricity, and you push the button. It reads that this is the disinfectant tube. It's going to start the spinning cycle just like it was doing before. It's just sensing which equipment you got on there. And when it's done spinning, it actually starts counting down from 55 minutes down to 0. When it gets down to 0, it will actually beep again and have the check mark just like it did when we were starting it up. At that time, make sure you turn it off and then unplug it. If you unplug it before you turn it off, it does not record that it was disinfected, and it will read as dirty equipment. So the next person that uses it might not be too happy. As always, if you have any questions whatsoever about this equipment or any other respiratory equipment, please get a hold of me. I'd be happy to help with any questions you may have.